So this is Karina, and she's sort of having a spell right now. And I'm Bonnie Lee, her mom. We're living in St. Joseph, Missouri, and she has Rett syndrome, which occurs in 1 in 10,000 girls. Everything is normal until she was 18 months of age, and then she lost her ability to speak, and she started to lose her fine and her gross motor skills. So I want her to basically be healthy and get all the support she needs throughout her life so she can teach us all about Rett syndrome and teach us all about a lot of different things.
John Matthews, a year and a half ago, I was diagnosed with pancreatic cancer, stage 4. I'm actually on a very aggressive form of chemo right now because my cancer, obviously, it wasn't operable. So they really had to kind of create a new thing for me. I have a very rare form of pancreatic cancer. So kind of created our own little thing. So they actually put me in touch with the board of the integrative clinic now. So they're actually bringing in craniosacral therapy and stuff like that for the patients. You try to find a silver lining in everything, so I'm just happy to be here. I love all you.
Great.
My name is Ricky Williams. I'm a retired NFL football player, and I'm here generally to improve the quality of my life. I think compared to a lot of other retired football players, doctors say that I'm great, but I know that there's more. Specifically, I'm starting to feel the effects of playing football. I'm starting to feel numbness and shooting down my left arm. Starting to feel a lot of compression, and I'm hoping just to release, the compression that I'm feeling in my head, and to just allow me to be more open and free. And this has come at a very vital time for me as I'm going through a lot of changes in my life, and just got divorced and really ready to step up and move forward and enter the second half of my life. And so I'm so glad to be here, and the timing is perfect.
I always tell people watching a craniosacral therapy session is a little bit like watching a sailboat race. If you're on the shore and you see the boat out on the distance, it may not look like much is going on. But if you're on the boat, you got to feel the waves and the wind and the rocking and all the different things. And that's what it's like for a patient who is very in tune with their body. They can feel some of those subtle changes, as it relaxes in the body. And for the therapist who's feeling for the response to their touch under their hands, waiting for those tissues to relax and to soften and to really allow the body to do what it needs to do in order to heal.
The craniosacral system is made up of the meninges, or the membranes that go around the brain and the spine, and actually go through it, transverse it as well. And so basically that is what affects your whole body. So if there's wrinkles, so to speak, in that, then it can create little glitches along the way. And so if we can help iron out or smooth out those wrinkles so that all the body fluids, all the nerves work better, the cerebrospinal fluid works better, then we can help create a lot of change for the body.
Basic craniosacral therapy involves this craniosacral system at the core of the human organism. And it has a rhythm, or you might call it a pulsation or a wave that goes along with it. We call that the craniosacral rhythm. Our therapists are taught in the first classes to palpate and feel this rhythm.
When we start teaching craniosacral therapy from the intro class on, one of the first things we teach is how to feel what we call the craniosacral rhythm. And what we use it for is an evaluation tool to see, because you can feel it throughout the body, and it just lets you know where it's moving or not, depending on any restrictions or strain patterns in that area.
Once we're in touch with that rhythm, clients usually know it. In fact, we get really interesting comments early on in the therapy, like, I feel like somebody just touched something very deep in me. Sometimes people say, I feel like somebody touched my soul.
We're trained to have highly sensitive hands so that we can tell where the compensations have occurred, where there's lines of tension in the body, where fluid exchange isn't appropriate, and then facilitate the body to make that change. We really listen to that individual and guide the path, or along the path that they show us.
The craniosacral therapy itself allows the nervous system to really relax under your touch and make the most of every neuron you've got going in your body. It just helps everything work so much better. So that, whether you do or don't add other therapies to that mix, your central nervous system is more receptive to all that kind of input. We see a variety of different developmental disorders, of sensory integration kinds of issues. We also see a lot of kids and adults with concussions for the craniosacral therapy, which helps the nervous system to kind of relax and to work better so that their healing from those events can occur much more easily.
So on the first day, Melinda worked in my mouth, and for as long as I can remember, I felt a lot of compression in my head, as if my body's really been calling for mouth work, and so it felt really good. And with that compression, I also felt that there's a disconnect from the top half of my body and the lower half of my body, and I'm not sure where it was, but someone was on my legs, and I started to feel that connection start to come back.
Ricky's wonderful and very open, but what struck me, having seen him, he went through the first concussion program, and he was in part of the second concussion program. And I didn't have a lot of time with him during the first concussion program. I don't know if either of you did, but what struck me was the degree of compression he still had in his structure. His vomer was sucked up into his sphenoid, and it felt like it was pulled down in the posterior throat. We needed another hand to get the throat piece. So whatever happened to his sternum and his face, I found at one point I was pulled into his chin.
We started yesterday, and we started on the tables inside of the room, and my body loves CST, and it responds really well to it. So I had a great session in the morning, and I really feel that things opened up and started moving. And we went to the dolphins. At first, I was surprised that the dolphins are just right there, and they're so friendly and inviting. And so I got really giddy and excited to get into the water. I was skeptical that the dolphins would be interested enough to come up, because I saw that they had free reign to go anywhere they wanted in this area. So I was skeptical that they would come and spend that much time with us, and specifically spend any time with me. As I got in and laid down, immediately there was a sense of peace as I relaxed, and I could hear the dolphins speaking, communicating, the dolphin noises that you see on television. I couldn't tell how far away they were, but I could tell that whatever they were doing was directed at me, because I could start to feel energy or intensity in my body increase. My body had some releases, and I wasn't sure if that was the work the therapists were doing or the dolphins. They touched me at my head, they came up by my left arm, and I definitely feel the intensity in my body. And it really felt like there was a connection between the dolphins and I, it's hard to describe what they were doing. I have no idea, but I could sense that there was something going on. I could feel my liver starting to become more active. I could feel energy going up and down my spine more. And to me, I wasn't sure, again, if it was the therapist or if it was the dolphins. And when I got out of the pool and I talked to my therapist, she said what was interesting was when your body had releases, 100% of the time it was aligned when the dolphins were looking at you or touching you. And it really got me curious. My perspective on dolphin therapy is really, to choose a word to describe it, was curiosity. So, I consider myself a spiritual person, and I've run into literature, books talking about, dolphins, how intelligent they are, and that they could possibly have a message to deliver to us, to humankind. And so it piqued my curiosity. There's definitely something going on. I mean, the fact that where I felt the dolphins on my body were places that I've had significant injuries, was the first thing that got my attention. And I think what's been most impressive was the way I felt today, getting out of the pool. Whereas yesterday I could barely stand up getting out, and today I felt like I wanted to run. I wanted to run sprints, or I wanted to do something active. I had so much energy, and I just felt so happy and present. There's some interaction. There's something going on in that pool.
Yesterday in the water, what I really wanted to do is just kind of clear off any last remnants of any cancer that's on my pancreas, liver, whatever, just kind of clear that out. And then work on some of the symptoms, and you get like neuropathy in the hands and feet and stuff, and they're actually doing really, really well. I mean, they're just a little numbness and tingling, but they're doing really well. And as I mentioned, obviously nausea is a real issue, but I've had no problem. I've eaten a lot of the different Bahamian foods, done well with it, and everything seems to be going good. And I'm sleeping through the night, so things are good.
Well, he had a great day today. He really wants to focus on getting rid of the cancer, because he's been in remission, and then these cells came back, these tumors came back, and so we want to kind of just get rid of it completely. And he's very confident that that's going to happen. So, we've got actually, fluid really moving, and lots of tissue movement. Also, building his cell count and really getting into his sternum. It's like a little powerhouse for him. But he'd forgotten that his sternum did that. So that was a good connection. And and then all the dolphin stuff was all just moving fluid. They just splashed over him and moved stuff and rippled in the water, and it was awesome. It was great. Great day.
So the washing stuff was
yeah, just the whole theme of the day was just washing away.
I get treated on the tables and stuff all the time, but there's something about being in the water that to me kind of take me to another level in a lot of ways, where the water you're just kind of floating, and especially when my head goes underwater and stuff, I can kind of drift off a little deeper. When I'm on the table, I'm very communicative. I talk with the therapist and stuff like that. Sometimes we'll joke, sometimes we'll talk about what's going on with me. But when I'm in the water, I just kind of zone out and I go in my own place. And where I'm at is, I'm not mad, I'm not angry, I don't hate my cancer or anything. Cancer is doing what cancer does. It doesn't know any better. So what I kind of feel is that, I don't think the cancer is trying to kill me. I think it just doesn't know what it's supposed to do. So it's kind of my job in a way to try to let the cancer know that I don't hate it. I want to get along with it, but what it's doing is going to kill both of us. I actually appreciate some of the awareness that is brought to me. I really respect it, and I've really kind of come to again appreciate the doors and stuff like that it's kind of opened for me and made me aware of different things that are going on. So I've actually learned a lot. It's interesting because when you look at the prognosis and the diagnosis of what I have, it can actually look really dire, but I just don't feel that way. Well, it's amazing. I mean, if you were to look at me right now, you probably wouldn't realize what actually I'm doing to my body with all the chemo and everything. In fact, about 6 months ago, I guess, I went in and saw the nurse practitioner. I also received radiation and cyberknife. I've done quite a few different things. And when I went in to see her, she said, "I just can't believe how well you're doing." She said, I can't imagine that you're walking around, let alone driving yourself here. And she said, tell me again what you're doing. So I started telling her, I said the craniosacral again. And she goes, oh my God, craniosacral therapy, I love it. She goes, I've been getting it lately. So she starts telling me about craniosacral therapy, about what it does and all that. So I still hadn't told her who I was, but she was on a roll, so I just kind of let her go. So then at the end I said, well, do you know my affiliation with craniosacral therapy? And she's like, well, you're getting it and you're doing fantastic. I said, well, actually it's a little more than that. I said, my father actually developed it. She nearly fell out of her chair.
Dr. Upledger created a genius system. He helped all of us learn how to look at the human body in a different way. In osteopathic medicine, they look at the body as an integrated totality, and that truly is where he came from. But what he did additionally was help us to learn to listen to the message that each individual body carries so that no two people are alike. And I like to say I have highly educated hands, and I'm a very good listener, and I happen to listen with my hands.
One of my best experiences with him was in a class where I was working on somebody, and he put his hand right on top of my hand. And all of a sudden I could feel some of what he was feeling. He blended with what I was feeling and then let me feel what he was feeling in the client. And he showed me what he was feeling in the client and what the client was showing him. And together we were able to work. He was asked to hold some tissue during an operation, and he was asked to hold it still, and he couldn't hold it still because there was a pulse there. And it wasn't the heartbeat, and it wasn't the respiration, and he felt this pulse. And this, I know, stimulated him to saying, what's going on here? And so he developed basically craniosacral therapy. His approach was, I can teach people some very simple techniques where a parent can help their child, or a massage therapist can help their client, or a PT can use in their practice, or a medical doctor can use.
My father was a very, very complex person. It made him very, very interesting. He was probably one of the most critical thinkers I've ever met in my life. Wherever he was involved, he was one of the people that actually contributed to a conversation. Growing up as a child, when he was 5, he started playing piano and accordion. So actually at 5 years old, I guess, he played the accordion on one of the little ferry boats at Belle Isle, you know, for tips. And growing up through high school and college, he worked his way through college playing piano. Actually played piano through medical school. So that's where he earned extra money. One time in high school, I was actually just making some spaghetti. Just making spaghetti, Chef Boyardee, had the sauce going and cooking the noodles. And on the box or whatever, it said to take the noodles and rinse them off in either hot or cold water, I can't remember. So I turned the water on, was letting it run, and to either get warmer or cooler. And he came walking by and said, why's the water on? I'm like, oh, I'm, letting it warm up or whatever to rinse the noodles. He's like, what are you doing that for? I'm like, well, because that's what it says. And he says, who says? I go, Chef Boyardee. He's like, well, who made Chef Boyardee the authority, right? So that actually led into like a 30-minute discussion about the physics and science of whether it's better to rinse noodles in warm or cold water. But that's what it was like kind of growing up. He really taught me that just because someone tells you something or you think something because, you might have seen something, doesn't mean it's actually what it is.
He was larger than life, and it was amazing to meet him and watch how the other therapists revered him, and later understanding what a healer he was and how many lives he touched, mine included. We came in August of 2004. He just connected with Graham right away. Formed a relationship with my son that later turned into, I really considered him more like a grandfather and a father figure to us. He always said to me, you're the only parent that didn't ask me to fix your child. I just wanted Graham to have peace, whatever that was for him, and I didn't understand what was going on, but I knew he was unhappy. Graham was born into this world in a very traumatic and difficult way. He was born at 35 weeks. My placenta abrupted, and we knew something was wrong right away. And soon after that, he began crying, and it was nonstop. We had about 4 straight years of crying and no sleeping, and I was desperately looking for anything that could help my son. And so we made multiple trips to the Bahamas. We went to see Dr. Upledger in his clinic in Florida, and incredible things happened. The dolphins taught me that crying is communication. So I learned to understand his cries. One was scared, one was just telling his story. And once he was able to tell his story and he was heard, it just stopped. It was magical. He just stopped crying. That was it. It was all silent, and we all stood there and went, wow. There wasn't anything else you could say. It was just incredible. And when it was over, it was over. And it took many, many years to find craniosacral therapy. But once we did, his life changed, and so did ours.
I think the irony is that both of us being physicians, that modern medicine really didn't have anything for my daughter at that time. Because at that time, she hadn't developed seizures or scoliosis. She developed that at age 9. So this was at age 2 that she was diagnosed. For years, there was really nothing for her. So everything that we've done is alternative medicine.
Traditional medicine, allopathic medicine or therapy is built on really doing something to help somebody do better. And it kind of takes the control away from the individual. We're always trying to fix something. And most of us in healing professions are very used to trying to fix something. This comes from a slightly different perspective in that you're really helping and assisting that individual to heal themselves. And when you do that, they take responsibility for their well-being.
I feel like Karina's enjoying her experience. She's enjoying being with her therapist, and she's happy. And we slowly walk back to the room by ourselves, which was a long walk.
She seems very comfortable in the pool, with the therapist, very relaxed. That's what was the feedback from the therapist, She's done this many times, so I guess she probably knows the routine, but she seems to be very, very relaxed when she's out there. Things have happened in my life that I cannot explain scientifically, including my daughter. She, to me, is a walking miracle, and I can't really explain that. And I'm basically a scientific person. Everything's based on science.
It's interesting because some of my dad's ideas and things that he put together seem so far out there. But if you knew my father, he always had one foot firmly planted in science, always firmly planted. And from there, he would take little steps. And if you just saw right over here, you know what I mean, you might go, wow, that's really crazy. But if you connect the dots, it actually makes sense. And my father was, as I mentioned before, an extreme critical thinker. He was his own harshest critic. So he would have to prove things to himself before he would go with it. And he really started to believe in energy and things like that. So with the dolphins, just if you want to break it down into scientific terms, their sonar is a type of energy. And if you could get the cells in your body to vibrate a little more or loosen up, what he found was that the cranial work and stuff could be so much more effective because the body was so much more compliant to what you were doing. So he had people working in the water even without dolphins just to kind of suspend gravity a little bit to try to help, the motion and movement, and then bringing in the dolphins with their sonar or energy or whatever you want to call it.
We can't measure their IQ, but I do feel that they're very, very intelligent beings. And the fact that they choose to be there, they have every opportunity to leave and go into the wild and be free. They choose not to, but stay with us. I have no idea what level they're functioning at, but I can see that communication between my daughter and the dolphins. It's there. The communication is there. I can't describe it, but I can see how she recognizes them year after year, and they recognize her, and they have this bond that keeps building every year. And so we're scared to stop and not come one year because we don't know how that's going to affect, because we don't want her to regress. I never got the opportunity to actually be in the water up until last maybe 6 sessions we were here. They had us all like a pod, you know, that we'd all be connected. We're all holding hands. I'm holding Karina's hand, one hand, and Bonnie's holding the other one, and then I'm holding Bonnie's hand. We're like in a circle, and we were all probably experiencing the same thing. We felt this sonar, this vibration. Your whole body goes through just about every single cell of your body. I can't really describe it when the dolphins shoot that sonar. And once she's in there, she's got this sense of familiarity, like they know her and she knows them. I don't know how to describe that, except it's all I get from her facial expressions because she's nonverbal. And so you can see the excitement and also the calmness as well, that she's not scared of them, however big they are or however bulky they may be. She's not intimidated by them. So I can't really describe that. This is what I see, is what I'm telling you, is that special relationship she's had, that bond she's had with those dolphins over the years keeps to be growing and evolving. And I'd like to see where that goes, and I hope that there are many more chances for us to come back and see where, it takes us.
We're at a point where, traditional allopathic medicine isn't working for athletes, and this is an alternative that I know works for athletes. There's a physical issue with athletes, but I think the other issue with athletes is most of us have been football players our whole lives, and we don't have much of an identity outside of that. And I find this work really gets you in touch with who you are at your core. And I think that's valuable for athletes, but I think it's valuable for everyone walking on earth right now. I've had a very interesting life, and at moments in my life where, pivotal moments where I could have gone either way, some form of a healer came into my life and really made a huge difference and put me on a track that felt good to me and helped me get in tune with what felt good to me. And it's made such an impact on my life. One, I love to do it, and two, I love to give back. And it's fascinating. I mean, every time I've put my hands on someone's body and listened to their craniosacral rhythm, it's an amazing experience. And to be able to do that for the rest of my life is heavenly. So my solid physical plans are to go to graduate school, and I'm studying depth psychology with a focus on somatic studies, so the mind-body connection, and really taking depth psychology and craniosacral work, putting it together and helping people tune into what's real and what's true for them.
We were the orthopedic surgeon, and we've been going there for about 10 years for scoliosis. And doctors never usually like to use the word miracle, but he said, it's a miracle what you guys have done. And I don't know what you two are doing, but you keep doing what you're doing, because Karina was the only the patient that he had that he didn't have to operate on. And then when we ask her about prognosis, he really can't answer, because he says there are not that many Karinas around, saying that a lot of his girls haven't made it to that age. So we feel very, very happy that we're obviously doing something right. I'm not a very religious person per se, but I'm a very spiritual person. I always feel like I've always depended on that, what I like to think of as divine intervention, that extra energy that's out there, that's beyond my control. I've always felt there's that extra presence there that's helping me do all of this and achieving all of this and giving me that extra strength and motivation. Without that in the back of my mind supporting me, I don't think I could have come this far in my life and my daughter's life.